what's the time? 4 minutes, beg your pardon, after 10, and you're tuned to Women Radio 91.7, the voice of women, Nigeria's first and only radio station for women and their families. And this is Radio Doctor on Women Radio 91.7 FM, Nigeria's first specialized radio health program where medical doctors consult for free and advise you on women radio. This program airs 10 a.m. every Monday through to Fridays.
Today's program is proudly powered by TeleDoc, a secure digital platform that allows you to consult verified doctors anytime, anywhere. With TeleDoc, you can book a quick consult for 10 minutes or a full consult for 30 minutes, choose your preferred time, join a secure video call within the app. You can also upload medical records and receive prescription digitally after your consultation. Every Wednesday and Thursday, we feature trusted doctors from the TeleDoc network to answer your health questions live. My name is Dimladi Okiwale.
And I'm Fumi Bangala. Today we're discussing a condition that many people know very little about, myself included, until it becomes a medical emergency, blood clots. Now, when you think about blood clots, you're thinking maybe if you're a woman from periods, or maybe you had an injury and you saw a blood clot. But a lot of people develop dangerous blood clots and they don't know that they're at risk. A person may be sitting for long periods, maybe recovering from a surgery, maybe taking certain medications, maybe living with obesity, maybe even managing a chronic illness without knowing that these factors increase your chances of getting blood clots. And the warning signs can sometimes be subtle. They are only discovered in most cases after a serious complication has occurred.
So today we'll be discussing who is at risk of blood clots, how do blood clots form, what warning signs should you never ignore, and most importantly, what practical steps can you take to reduce the risk. Joining us today is Dr. Adeshola Adebayo, a hematologist, who will help us understand blood clots, risk factors, and early intervention. Doctor, welcome to the program.
Thank you for having me, and good morning, listeners.
It's great to have you. It's great to have you. The time is 6 minutes after 10, and you're still tuned to Women Radio 91.7 FM, the voice of women. This is Radio Doctor, where we have Dr. Adeshola Adebayo, who's a hematologist, whichever way. And he's like Demi said, he's going to be talking to us about, blood clot and everything that it entails. Demi, to you.
All right, doctor. Let's start with the basics. What exactly is a blood clot?
All right. So a blood clot essentially is a solid structure that is formed from blood components. Okay, so blood has both solid and liquid components. The solid components are the cells, red blood cells, white blood cells, platelets. Okay, I don't want to go into the dynamics of those. But when these solid components find a way of coming together and forming one solid component within the blood vessel, that's the blood clot.
Thank you, doctor. So what's the difference between normal clotting that protects us and the dangerous clotting that causes disease?
Okay, so the normal clotting that protects us essentially is to prevent us from bleeding out if we have an injury of some sort. And that normal clotting, there's already a mechanism by the body to break it down as soon as the area of injury has been sealed up. But the blood clot that happens within the blood vessel, blood clots are not supposed to happen within the blood vessels. They are supposed to happen at an area where there is injury, where there's a breach in the blood vessel. So when there is no breach, there is no injury, yet you have blood clots forming inside the blood vessel. So that's the difference, and that's the bad one.
Thank you, doctor. So where in the body do harmful blood clots commonly occur?
Okay, so we have two types of clots essentially, depending on where the clot happens. There are the arteries and there are veins. These are types of blood vessels. So these clots can happen within the arteries. These clots can also happen within the veins. But most commonly, the clots that we usually have patients presenting to the hospital with are the clots that happen within the veins. And the veins that are mostly affected are the veins of the legs.
So why can blood clots then become life-threatening so quickly?
All right. When the clot first forms, it forms at the area, it's just like blood cells met for a conference. And then at the point, at the venue of the conference, all of them are gathered together. So the clot forms there. And the danger of that clot forming there is that blood is unable to move freely. There's an obstruction already, so blood flow is compromised. But the one that we fear the most is when they now dislodge from that place of meeting and the blood flow takes it to sensitive places like the heart, like the lungs, like the brain. So when it goes to the heart, it can cause a cardiac arrest. When it goes to the lungs, it can cause chest pain, difficulty with breathing. When it goes to the brain, it can cause stroke. So these are
Mm,
the dangerous things that those clots can do when they dislodge.
mm. Thank you, Doctor. I'm going to take you back to your last answer where you said it commonly happens in the leg. Is there any reason why that is the most common place where it happens?
Yeah, so we human beings, we are vertical, we stand straight. And
Mm,
it's just like when you have a well or a borehole, the water is on the ground. If you want that water to get into your overhead tank, then you have to use something that can go against gravity. That's like
mm,
using a pumping machine or something. So, in the same way, blood in itself cannot go against gravity. Blood that goes to the legs has to find a way to get back to the heart so that it can be
mm,
repumped around the body. So, the muscles of the legs have been designed to help us as that pump, so that for every time we are moving or we are walking, it serves as a pump to take that blood back to the heart. So, most times when
mm.
people don't move, and or they are bedridden for any reason at all, that pump is technically not working. So blood pulls down by gravity to the legs. So that's why the legs are the most common places where clots form.
No, thank you very much, Doctor. So from your experience, are blood clots more common nowadays, or are we just simply diagnosing them more effectively nowadays?
I think we're diagnosing it more effectively nowadays. In those days, it was common tradition to think that if somebody suddenly complains of chest pain and then passes out, they will say that it is the village people that fired an arrow from somewhere.
Mm,
But now that we know the technicalities, we know the medicine behind these occurrences, we are able to diagnose them better, detect them earlier, and prevent them.
thank you very much. Over to you for me.
All right. Now, doctor, who are the individuals most at risk? You mentioned, oh, we're always on our feet a lot, but who are the individuals? Is it just people on their feet, or does it affect every other person? Oh, we are mostly on our feet now. What am I saying? So, who are the individuals most at risk? Is it a case of, oh, I'm always like, for instance, I'm sat most of the time, like by virtue of the kind of job that I do. Am I at risk of developing blood clots, or do people who are very active, do they develop blood clots, those kind of things? Yes, please go ahead.
All right, so let me start with the commonest clots that occur, which are the clots in the veins. So people who are at risk of those clots in the veins include, if for any reason you have to immobilize for a very long time, people who are used to long distance flights, chief
Yeah.
executive officers who will sit in offices and attend to meetings for like 6 hours, no stretching, no movement, okay? People who are bedridden for one illness or the other, people who may have had surgery on their legs and then so they can't move until they heal, and people who have diabetes, okay, hypertension, and people who are on continuous use of oral contraceptives. Those contraceptives have a way of increasing the substances in blood that makes our blood clot easily, so they are also at risk. Pregnant women are also at risk because as the baby is developing, especially in the last 3 months of pregnancy, which we refer to as the third trimester, the baby is now big. So the baby puts pressure on one of the major veins that passes through the stomach and goes back to the heart. So even if the woman is moving and all, there's already some sort of obstruction around the stomach area. So blood flow is still a little sluggish, and so they have a tendency to develop such clots. For the clots that happen in the arteries, people who smoke are more at risk of having such clots, okay? People who are obese, okay, because of a lot of fat within their blood vessels, so it slows down blood circulation, and they're at risk of clots too as well.
Thank you so much. You've answered all my questions actually before I ask them. Demi, over to you.
All right, doctor. One of the challenges with blood clot is that many people don't recognize the symptoms. So, what symptoms should listeners never ignore?
All right. So, like I said, most of these clots happen in the legs. So, when you suddenly realize that one leg is swelling more than the other, and in addition to swelling, there is pain in the calf that's behind the leg, unexplained swelling, unexplained pain. There was no trauma, there was no nothing, and all of a sudden you're feeling that pain. That should not be ignored. Then, sudden chest pain that is unexplained and it's accompanied by difficulty with breathing. That may be a pointer to the fact that the clot has left the leg and it has traveled to the heart and the lungs. Also, suddenly blanking out, just pass out like that, darkness for some seconds or a few minutes. That may mean that there's a clot that may have dislodged to the brain. So all of these symptoms should not be ignored.
Okay, doc. So, you mentioned the blood clot in the leg and the calf earlier. Um, so, what does a typical clot in the leg look like? I know you mentioned swollen. Are there any other things that people should look at for sensitivity, things like that?
Yeah, apart from the pain and the swelling, some people may discover that the veins underneath the skin, those ones that we can see sometimes, they look greenish or they look dark in color, depending on your skin complexion. They may start becoming very prominent, what we call varicose veins. Now, I have to say this, that not all varicose veins are due to blood clots. Some people are just naturally, they have that tendency to have those clots. But if you never had those varicose veins before, and then all of a sudden you experience swelling in your legs, you experience pain, and then the veins around that leg from the knee downwards start becoming very visible and very prominent, then you know that there's likely an obstruction somewhere which needs to be checked.
Oh, thank you, doctor. So, in such an instance where an individual, let's say, by maybe there was an injury or something that they were not aware of and they had leg pain, how do we then distinguish between ordinary leg pain from a possible blood clot?
Yeah, so what we ask such patients, of course, when someone comes with pain and swelling is that, did you have an injury? Did you fall? Did something hit you? And when all of those questions we get in a negative answer, no, I didn't fall, no, nothing hit my legs. I just realized that progressively my leg is swelling. And then there's one thing, some people may go further to like elevate the leg by themselves. They may just put a pillow underneath that leg in order to make it reduce. So if they give us a response that, okay, when I put a pillow under that leg, somehow I realize that it reduces, then all of those become pointers to the fact that we're likely dealing with a clot and not an injury.
Mm, thank you, doctor. So, I know you mentioned, so for the leg, we have the swollen leg and the calf, and then for the lungs, it could be chest pain, and then for the brain, blackouts. Are there any other parts of the body that blood clots can actually appear in? And in such situations, what are the symptoms? Or is just those three parts that we've mentioned?
Yeah, blood clots can also occur in some other areas, though it's rare. For instance, blood clots can occur within the liver, and that
Mm,
can be a cause of liver failure in a patient when they suddenly realize their eyes are getting yellow, their urine is dark yellow. That means that the functions of the liver has started becoming compromised. Blood clots can form in major vessels within the stomach. And when that
Mm,
happens, the patient starts complaining of excruciating tummy pain, sometimes with vomiting, sometimes with constipation, okay, because when there is a clot in the vessels of the stomach, the area of the intestine that that vessel supplies cannot work as it should. So the whole movement of food from the stomach through the intestines for it to be passed out is compromised. So such patients can start developing tummy swelling, tummy ache and pain, vomiting, passing stools. But like I said, these are they are rare. They do happen. They are rare. Most times, even as doctors, we will have looked for other things before
mm.
we now realize that, oh, what we're dealing with is a clot that formed in a very unusual site.
Okay, thank you, doctor. So are hemorrhoids blood clots as well, or it's a totally different? Um,
Yes, yes. So hemorrhoids are also a form of clots that have occurred within the blood vessels that lead to the anal passage. Yes, that comes from repeated constipation, having to force out very hard stool. So, for instance, if somebody gets constipated after 3, 4 days, now that person is to pass stool, that pressure of
mm,
pushing the stool will momentarily cause a blockage of blood flow. Now, if that continues to happen repeatedly like that, there's a chance for clots to form within the blood vessel affecting that area. So that's what we now see coming out. But the the hemorrhoid that we usually refer to as the one due to clots is called thrombosed hemorrhoid. Sorry, I'm using a medical terminology. Thrombosed means that the blood vessel has been clotted, blood is unable to reach that particular area of the large intestine that pops out, and so it leads to swelling, it leads to pain. Such people, when they come to hospital and we examine them, you see that there is a protrusion that usually
mm,
appears dark in color. So that one, we know that this was due to, a clot has formed, and this is what's responsible for what we're seeing.
mm. Thank you, doctor. So how important is it seeking immediate medical attention when these symptoms appear?
Yes, because of the complications of this clot, which we do not like at all. The complications can be very fatal, very fatal. So the best thing is to detect this clot before it dislodges. When it is still in the area where it was formed, we call it a thrombus. When it dislodges, we call it an embolus. So we
Mm,
are more afraid with an embolus than a thrombus. So once you realize those symptoms I talked about in the legs, most especially, it's a reason for the patient to quickly present to the. It's better for the patient to come and then we tell you, oh no, it's not a clot. We have checked you. It's something else, than to think, oh, it's just one of those things. It will pass.
mm. Thank you, doctor. Thank you, doctor. Doctor, so many people have risk factors for blood clots that they don't know about. How can telemedicine help them identify concerns before complication actually occurs?
Okay. Like there are a number of conditions that can cause blood clots. I mentioned things like hypertension. I mentioned things like diabetes and all of that. So if people have a culture of keeping an eye on their blood pressure, for instance, they will get to know when it's getting out of range. And if they're able to detect it early, of course, complications like blood clots will not happen. When people discover, for instance, that, oh, I'm peeing frequently every night, I am taking a lot of water than necessary, that may be a pointer towards diabetes. So if you are able to discuss this, via telemedicine, then the next advice you're likely going to be given is, okay, get a facility, check your blood sugar. Let's be sure that what you're dealing with is not diabetes. So that way, telemedicine helps people to not keep their symptoms to themselves. And it's like bringing medicine to the home of people, makes it convenient. So that way you tell us your symptoms and we're able to detect, okay, it could be this, could be that. And if it's detected early, we avoid complications like this blood clots we talked about.
That's right. Through Teledoc, patients can consult verified doctors, discuss their personal risk factors, medication, symptoms, and also receive guidance before a problem becomes an emergency. You're listening to Radio Doctor on Women Radio 91.7, powered by Teledoc. Teledoc allows you to book at your preferred time, join a secure video consultation, upload your medical records, and receive prescription digitally. It's healthcare made simple and secure.
All right, all right. We're gonna go on a short break. When we come back, we shall be continuing the conversation on blood clots this morning with our doctor. Don't go anywhere.
WFM 91.7.
Are you number 87? Okay, please wait. How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing Teledoc, your secure digital platform to consult verified doctors anytime, anywhere. With Teledoc, you choose how you want care. Need something quick? Go for a quick consult. Just 10 minutes. Need more time? Book a full consult. 30 minutes of personalized care tailored just for you. No traffic, no crowded waiting rooms, no unnecessary delays. Simply book at your preferred time. Join a secure video call inside the app and speak directly with licensed doctors you can trust. Have medical records? Upload them easily before your consultation. From general health concerns to specialist advice, Teledoc connects you to real doctors, real answers, real care. Download the Teledoc app today on Google Play Store and Apple Store.
WFM 91.7. Only you one.
All right, all right. Welcome back to Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. The phone lines are now open. On Radio Doctor this morning, we've been speaking with Dr. Adeshola Adebayo on blood clots, the risks of blood clots. So if you have questions about blood clot prevention, symptoms, travel risks, medication, and the like, you can call in, speak to our doctor, 07000 or 0800 1235917. You can send your text messages, WhatsApp messages, or voice notes to 0703 1756 537. All right. Thank you so much for doing this with us, Dr. Adeshola. We truly, truly appreciate it. Okay, so if someone wanted to reduce their risk of blood clots starting from today, what are the most important things that they should do?
Okay, so one of the slogans for reducing blood clots or preventing blood clots is keep moving. Keep moving, because prolonged immobilization is about the most common reason why a lot of people come down with blood clots. The exercise that cardiologists usually recommend, that 5 times a week, if you can do a brisk walk, just 30 to 40 minutes, take a stroll, go come back, it's not only important for the health of the heart, it's also important for the prevention of blood clots. Since we have no other pump in our body except the muscles of the legs, so we need to use those muscles so that the blood can easily get back to the heart. So make exercise a regular routine. If you are someone who has to sit for long at work, make it a duty every hour, at least every hour. You may want to stand up, just stretch your legs for like 5 minutes or thereabout. Okay, if you're in a meeting, just put your hands up and say, sorry, I want to use myself. You don't actually want to use yourself, you want to move your legs, so that you don't have a clot there sitting down. And then as simple as taking water regularly. A lot of people take pride in saying, I only take 1 sachet of pure water a day. It's not something to be proud of. It's dangerous, because the person ends up making the blood more thick, makes the blood thicker, more viscous. And anything that will make the blood thick will make blood clots form. So regular exercise, mobilization, rehydrate, okay? These are very important things. Smokers, please, you need to stop, because it can really, really cause blood clots. Alcoholics need to reduce on it. Okay, so these are some of the points so far.
Those are like lifestyle changes that we must have and inculcate anyway to be able to avoid this, right?
Absolutely.
Okay. What about weight management? Because from all you've said, um, if a person is big, obviously there's a lot of pressure on the feet, which might cause uh blood clots. How does that affect blood clots, and how can one reduce how can one work on their weight to reduce clotting risk?
Okay, so the idea is that for somebody who practices regular exercise, one of the advantages of the regular exercise I talked about is that it will also help with weight. All right. Then other modalities like dietary modification can also come in, to help with weight. But it's very important. Yes, obesity is a major risk factor, and working on one's weight will significantly go a long way to reduce the risk of clots.
Okay, what about things like or diseases? I suppose that diseases like diabetes and hypertension, how do they come into play when it comes to blood clots?
Okay, so these diseases, the patients that have them have a high risk of having clots within their blood vessels. So if hypertension is well managed, if diabetes is well managed, the chances of developing a clot is very much reduced. So for people who know that they have these conditions, the idea is don't sit in silence. Like there is help for you. There's medicine has gone beyond, medicine has advanced so much that there is treatment tailor-made for specific conditions, all right? So when these things are well managed, it reduces the chance of a clot being formed.
Okay. All right. Thank you so much, Dr. Demi. Over to you.
All right, doctor, thank you so much. Why do blood clots often seem to come as a surprise to patients and families?
I guess it's because most people don't even know, they're not aware when they bled out. Um, they don't know that something like that exists. And by the time they would now discover that a clot has formed, most times it has dislodged. So the first time some people are knowing they have a clot is when it has gone to the chest, to the heart, or to the lungs, and then difficulty with breathing, chest pain, and all of that. That's why it comes as a surprise to most people. Perhaps they never took note that one leg was becoming bigger than the other, but they thought, oh, okay, maybe it's just an incidental thing. So that's it. Most people get to discover it when the emergency has happened.
Mm, Thank you, doctor. So do you think in terms of like the public, do they underestimate the seriousness of blood clotting disorder?
Yes, they do, to be honest, they do. Most people know about hypertension, most people know about diabetes. Those are common conditions that people know. But things like, oh, a clot forming within my blood vessel, like why? It's not something
Yeah.
that most people, are used to. Yes. So there's still paucity of knowledge and awareness about blood clots and what it can do.
Okay. So in terms of obviously because there's not much awareness on blood clots, there will be some common misconceptions as well about blood clots. So what are those misconceptions?
Okay, so there's this cultural practice in the core north where this person will hold the horn of a cow and then say that, oh, some bad blood has accumulated in somebody's leg or a part of the body. And what they need to do is to make incisions and then insert the cow horn and then suck the blood out and all of that. These are some of the misconceptions. Even if it's a clot that caused accumulation of blood, it is not by putting that incision in the name of draining out bad blood that will
Mm.
take care of that clot. All right. The condition that caused the clot has to be addressed, and medications that need to be given to handle the clot has to be addressed as well. So the concept of, oh, I have bad blood inside, and the bad blood is what is causing the swelling is a major myth which has to be demystified.
Mm. So let me just to follow up on that answer. So in an instance where somebody has a blood clot in their leg, is this treated by medication or the surgeries or things? What exactly is the treatment plan?
Yes. So there are medications we give the patient, but the should I say the interesting thing is that the medication is not supposed to dissolve the clot. You see, the way we are uniquely designed, the body is supposed to be able to handle any clot it encounters. The problem why clots now form is because the mechanism to dissolve clots has been overwhelmed by the forces that caused the clots. So when we give a patient medications when they have a clot, we are preventing the formation of new clots while giving the body, the natural system, the time for it to dissolve the clots that has already been formed. Now, when those medications, when that does not work, then that's when one now begins to think about surgery. And the surgery, there are two aims of surgery. One surgery is to put a filter between the upper part of the body and the lower part of the body. That big blood vessel, I said, it goes through the stomach. Okay, so it's called the IVC, inferior vena cava. So you put a filter there so that even if that clot dislodges, when it gets to the filter, it is trapped. So it's not able to get to the heart and the lungs. Another surgery is to go into that blood vessel and bring out the clot. That's been done by vascular surgeons, but they are in very short supply in Nigeria. So we have to go with the use of medications, as it were, so that it can deal with the clots.
Thank you, Doctor. So can someone be healthy, active, and still develop blood clot?
Yes, that is if the person has an underlying. Okay, so there is this thing that has also been found from research that there are some people that are born with a natural genetic tendency to develop clots. For some reason, some specific factors are missing in their blood, and that puts them at risk of having clots. So people who have that kind of genetic tendency can still be active and yet develop clots.
Mm. I was going to follow up with that with in terms of personal and family history. So I'm guessing the genetics is possible for if there was a history of it in your family, you might be have a probability of having it. Is that correct?
Very correct. And these are people we usually diagnose in their 20s, before 20 or in their 20s. So when we detect a clot in someone who is that young, who we assume should be active enough, immobilization should not occur in youth. But then a youth coming down with a clot, the first thing that comes to our mind is there anybody in your family who may have had it? The medical word for it is thrombophilia, meaning that the person has an ability to form clots easily.
Mm. Thank you, doctor. So we mentioned heart disease, chest pain, stroke, and obviously those particular diseases, there's a lot of awareness on them. So should blood clot awareness receive as much public attention as those things, since blood clot actually leads to those diseases as well?
I perfectly agree. It should be part of the awareness, both in those who have the risk and those who do not have the risk. It's important to let people know that when I tell you to exercise, exercise, it's not a punishment sentence. It's not a sentence, to punish you, but it is to prevent things like blood clots happening within your system. And then for people who already have conditions that one of the complications that could come up is blood clots. They also need to be educated. Perhaps that will also help them to be more compliant with medications and follow-up clinic visits, because if they are not compliant, one of the consequences of what they have is a blood clot.
Thank you, doctor. I have one last question. So I know we spoke about how someone can be healthy, active, and still develop a blood clot. is there any possibility that somebody can have a blood clot without any symptoms shown?
Yes, that is also possible. For instance, now people who are on the plus size may not quickly note that they have a swelling in the leg
Mm.
because the swelling might
Mm,
not be that big, okay? It might just be a subtle difference between one leg and the other. So the first time that they will develop the symptom of a clot is when they have that chest pain or all of those complications that I talked about. And then, I also said that blood clots can occur in very rare locations. So that blood clot I talked about, which can occur within the blood vessels of the stomach, for instance, the person may not even have so much symptoms except for maybe mild abdominal pain, which he thinks is just, I ate something that was not so good, or okay, I think I want to have a fever or something, I have food poisoning, and then not knowing that it's a clot that is doing something over there. So yes, it's very possible. It's possible.
mm. Thank you, doctor.
All right. Thank you so much, Doctor. I think to Demi's question on personal, knowing your personal and family history, I was just thinking that how is it that me, innocent me, like I didn't ask to be born. Why am I collecting something from, I don't know if it is a forefather or whatever from the person that has it, the parent or the family member that has it. But how is it me, innocent me, that has no, I was not there when they had it the first time. Why am I also getting? Why do I have to check myself, right, for this thing? I actually want to know because it's like every time you go to the hospital, they would ask you, is there history of diabetes in your family? Is there history of hypertension? Is there history of this? Is there history of that? And I'm like I'm a fresh person. Why am I collecting the flag for somebody else's whatever?
Okay, so you are a fresh person, but let's remember how you were formed. You were
Mm,
formed by donation of chromosomes from father and mother. That was how this fresh person was formed. So it's possible that this fresh person that was formed has taken something either from the father or from the mother, and then unfortunately, it just happens. It's an unfortunate situation, though. Yeah, but then it happens.
Wow. Okay. I was just so stuck on that. I was like, me. Like even blood clot again is also genetic. Like it can be passed down. Like what is there that is not that can't be passed down? Okay. Anyway, moving on. This is still Women Radio 91.7 FM, and we'll be speaking with Dr. Adeshola Adebayo, who's been helping us understand blood clots and risk factors and how you can prevent and treat it. So, what practical habits would you like every listener right now to adopt to reduce their risks?
Okay, so adopt a lifestyle of moving. Again, I'll say it again and again. Keep moving,
Mm,
keep moving, keep moving. Don't have yourself sitting for prolonged periods of time without standing up, moving your legs. Okay, and then when you sit down, don't also have this habit of crossing your leg for too long a time because that will also slow down blood flow, back to the heart. I also encourage people to keep hydrated, at least 2 to 3 liters of fluid in a day. And people should understand that carbonated drinks it's not hydration. So because some people will tell you that, oh, I take that a lot, I'm taking 2 or 3 bottles. No, it's not hydration. In fact, you are worsening things, okay? So water, as cheap as water is, it is effective in preventing a lot of disease conditions. And then people who indiscriminately use oral contraceptives for the sake of, their lifestyle,
mhm.
uh, contraceptives that were not prescribed by medical professionals, it's risky. It increases the chances of blood clots. For people who know they have hypertension, diabetes, or any of these conditions that can increase the risk, they should ensure they are compliant with their medications and doctor's orders. For those who unfortunately maybe have a stroke or have a surgery on their legs and they cannot legit move, what they can do is anytime they're either seated or lying down, have a pillow or two under the leg where that surgery happened so that that can help. Gravity can now help to push blood back to the heart quit smoking, reduce alcohol consumption significantly. I think those are the ones I can remember for now. As they come, I'll say it.
All right. So, what symptoms from all the ones that you've listed should be treated as emergencies?
Okay, chest pain, sudden onset chest pain, sudden onset difficulty with breathing, passing out, like going unconscious. These are markers that most likely the clot has dislodged. These are common presentations, common symptoms that shows that this thing has dislodged to very dangerous places.
Okay. And finally, what is that one thing you would like every single listener to remember about blood clots and prevention?
Okay, so they should remember that in the design of the human body, a mechanism has been effectively put in place to prevent clots from forming. That is, to allow blood from the legs to return back to the heart in peace and safely. The problem is that most of us are not using this natural mechanism. And what is that natural mechanism? Walking, being active, exercising. Okay, so if you not take anything away from this presentation, remember to prevent clots, keep walking, keep moving.
Keep moving. Thank you, Dr. Adeshola Adebayo, for joining us today and helping us understand blood clots, the risk factors, and the prevention. If you need to speak to the doctor privately, download the TeleDoc app. You can book a full 30-minute session with the doctor, choose your preferred time, speak securely via video. If you want to upload your medical records, you can do that, and also receive prescription digitally.
Yes, thank you once again, Dr. Adeshola Adebayo, for joining us today. Thank you so much for coming on the program. I learned quite a few things on blood clot. The number one being that it is hereditary. That's the one I'm going to take along with me as I go. Thank you so much, Doctor. Tomorrow is a public holiday, but I know that essential services don't have a holiday, but I'm hoping that you try to rest tomorrow while everybody is resting. On that note, thank you so much. This is Radio Doctor on Women Radio 91.7, Nigeria's first specialized radio health program, broadcast Mondays through Fridays at 10 a.m. Join us tomorrow morning for another edition. Demi, it was great doing this with you this morning.
You too.
Yeah, have a great day.
Have a beautiful day.
Thank you.
Women Radio 91.7, breaking the culture of silence.
To sponsor this program, call the number 0816 480 7613.
Nigeria, a nation of many languages and many tribes. We will stand together, live together, and grow together. United we stand, united we thrive. This message is brought to you by Women Radio WFM 91.7 FM.
Are you number 87? Okay, please wait.
How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing TeleDoc, your secure digital platform to consult verified doctors anytime, anywhere. With TeleDoc, you choose how you want care. Need something quick? Go for a quick consult. Just 10 minutes. Need more time? Book a full consult. 30 minutes of personalized care tailored just for you. No traffic, no crowded waiting rooms, no unnecessary delays. Simply book at your preferred time. Join a secure video call inside the app and speak directly with licensed doctors you can trust. Have medical records? Upload them easily before your consultation. From general health concerns to specialist advice, TeleDoc connects you to real doctors, real answers, real care. Download the TeleDoc app today on Google Play Store and Apple Store.
Jíjẹ́ ọmọ ẹgbẹ́ Women Radio á fún ẹ ní àǹfààní láti darapọ̀ mọ́ àwọn obìnrin bíi tiẹ̀, yálà akẹ́kọ̀ọ́, oníṣòwò, oníṣẹ́ àdáni, òṣìṣẹ́ fẹ̀yìntì, ìyàwó ilé tàbí àgbẹ̀. ní gbogbo ìjọba ìpínlẹ̀ mẹ́rìndínlógójì ní Nàìjíríà. Tó o bá ti jẹ́ ọmọ ẹgbẹ́ Women Radio, a ó bẹ̀ polówó okòwò rẹ lọ́fẹ̀ẹ́, ó sì ní àǹfààní láti jẹ ẹ̀bùn tó jọjú lórí àwọn ètò wa. Forúkọsílẹ̀ ní wfm917.com, darapọ̀ mọ́ wa lórí Facebook, kó o sì download mobile app wa níbikíbi tó o bá wà. Jíjẹ́ ọmọ ẹgbẹ́ Women Radio jẹ́ ètò láti iléeṣẹ́ WFM 91.7 pẹ̀lú àtìlẹ́yìn MacArthur Foundation àti Nigeria Media Innovation Program.
The stories are real.
Something like this happened to me years back. I saw from message in his phone, a lady that sent a message to him. When I